Hello, my name is Melissa Baird, and I'm a third semester nursing student at Collin College with an anticipated graduation date of May 2021. After I receive my ADN, I plan on pursuing a BSN through Texas Tech immediately following. A little bit about me: I completed my bachelor's at TCU with a major in communications and a minor in arts administration. After that, I worked on the business side of medicine as a physician recruiter and a healthcare HR representative for Concentra. Through recruiting and training doctors, nurses, and NPs, I was blown away by how much they love their jobs and the impact that they made on their patients' lives. Their passion for helping others made me decide that I want to dedicate my career to serving others as well. So I went back to nursing school and have loved every minute of my career so far in nursing. What is my nursing philosophy? I believe in patient-centered care as a priority. Of course, all nursing intervention should be up to date and aligning with the hospital's policy, but I think that what makes a great nurse is specialize in care for each patient as an individual. As a nurse, I want to treat each patient not as a number or a disease, but treat them with compassion and humanity to heal the whole person. What do I believe is the most central concept to support excellence in nursing? I believe the most central concept is compassion and drive as a nurse. Compassion for each patient allows the nurse to specialize her care so that's most beneficial to the patient, and drive pushes a nurse to always seek out new ways of doing things and new practices so that she or he can always be the best nurse that they can be in regards to current practices in nursing. Where do I see myself in 5 years? Good question. In 5 years, I see myself working as a labor and delivery nurse, finishing up my studies to become a nurse practitioner. I definitely see myself in a leadership role and being on a team that improves processes at my hospital and helps train new hires. At my current position as a patient care technician at Baylor Scott and White Hospital in Grapevine, I was selected to be a preceptor for our new hire PCTs, which has been an awesome experience so far. I love training new hires and showing them the best way to do things while being safe and sharing our hospital's mission and vision. I think this pulls from my communications background and my recruiting, onboarding HR background. I definitely love improving systems, training others. So I definitely see myself in a leadership role in 5 years. Why do I want to work here? I studied your hospital, and I believe that you hold your healthcare providers to the highest level of excellence, which translates to the best possible patient care. I'm definitely a go-getter myself and a high achiever, and I want to join an organization that I'm passionate about. I think that my skills as a nurse can be shaped and molded into the best possible version of myself at your facility, because of the great work that you do and the excellent nurses that you already have on staff. I believe that I have a lot to offer, such as dedication, compassion, leadership, and positivity that I think align with your values. What do I see as my weakest and strongest areas in nursing? My strongest area is that I'm relentlessly positive and I keep calm under pressure while always pushing myself to learn more. I never give up. I do not get discouraged easily. If there's something that I don't know, you can bet I'll do everything that I can to figure out the right answer and apply that to my nursing skill set. As a tech, an example of this is that I carry a small notebook with me to work each day, and anything that I encounter that I don't know about, whether it's a procedure or a medication, I write it down to look up later once I'm at home, just so I can make sure that I'm always at the top of my game. My biggest weakness would simply be a lack of experience as a new nurse. However, I think my drive to be a lifelong learner will help me through this beginner period. What was my most rewarding experience in my nursing education? During my labor and delivery rotation, I absolutely fell in love with the unit. I thought it was so special and magical what the nurses were doing to care for their patients when they were at their most vulnerable, giving birth. I was shadowing a nurse at my clinical who was taking care of a woman who was in labor. I spent the day helping the woman and, more importantly, getting to know her and calming her down so she wasn't stressed throughout the labor process. At the time of delivery, the doctor came in and got ready to deliver. I asked him if there's anything that I could do to assist, and that I was passionate about labor and delivery, women's health, and I was eager to help and learn in any way that I could. He then asked me if I wanted to catch the baby, and of course I said yes. He guided me through stabilizing the baby's head and body as the baby was born, and I cut the cord and was able to show the mother her baby for the first time. It was an incredible experience. The family was so appreciative and kind. They thanked the doctor, nurse, and I profusely. I felt so proud that I was able to use my skills to help this woman at such a critical time. I also think that throughout the day, me really putting the patient at ease, getting to know her and her husband, made them trust me more and allow me to help her in this way. I also think that me asking the doctor if there's anything that I can do and really getting every experience that I could allowed me to have this great experience. Did I have an experience that I did not enjoy, and why? At first, it was challenging to perform menial tasks such as getting water or making a bed, just because I was so eager to use all of my nursing skills. However, I don't get discouraged easily, and I told myself, okay, I'm going to make this into the most positive experience that I can. So while I was performing these tasks, I spent a lot of time in my patients' rooms, just getting to know them, talking to them. I think this is so important in the hospital because people are at their most vulnerable. They might be scared, lonely, angry, upset, and just being an ear to listen to them and spend time with them makes them trust you as a nurse and put them more at ease with the whole process. Especially now during COVID, when lots of hospitals aren't allowing visitors or only allowing one visitor, patients' mental health can definitely suffer. So throughout that experience of just performing these smaller tasks, I learned that no task is too small or unimportant. Everything that we do for a patient is a chance to improve their situation and help them. Identify a conflict that I was involved in and how I managed it. So at my job as a patient care technician, we've recently switched over to Epic from Allscripts as our EMR system. I was looking through past charting of my patient, and I realized that another tech had charted that the patient dangled their legs at bedside. And I thought that the patient was bedbound. I had not seen them get up. I was told not to get them up, sitting up. So I was very confused by this. The other tech happened to be working, so I asked her what she meant by that. And she told me, oh, when we log rolled the patient side to side, we chart it as dangle legs at bedside. And something about that just didn't sound right to me because they're not actually dangling their legs at the bedside. And this woman had been a tech for several years. I was still fairly new at this point. So I didn't want to tell her that she was wrong, but I knew that that was incorrect. So I went to the charge nurse, asked her how we would correctly chart that. And she said, oh no, that would be a log roll, not dangle at bedside. So I then went back to the original tech to make sure that this problem didn't keep happening. And I calmly and kindly told her, hey, I checked with the charge nurse. This is how we're actually supposed to chart it, in a very non-confrontational way. But that way she knew so that she wouldn't keep making that mistake and training new hires with that mistake. I then thought that other people that she had trained may be making the same mistake. So I went to our float pool manager, told her about the discrepancy, and she actually sent out a bulletin with tips on how to chart these certain events so that that mistake wouldn't kept being made by others at our hospital. What do I do when I encounter a skill that I've never performed before? I would first research the skill and brush up on my knowledge of how to do the skill. I would never perform a skill that I know nothing about or don't feel confident in doing, because that could hurt the patient, and that's just not good practice. So once I feel confident in my knowledge of the skill, I would grab another experienced nurse, ask him or her to watch me, say, hey, I haven't performed this skill before. I feel confident in performing it, but would you mind watching me, maybe coaching me through it so you could give me some pointers on how I could improve? This way, when I perform the skill, they could tell me ways that I can improve so next time I can perform the skill better. Do I have a preference regarding what shift I work? I would prefer to work day shift, although I'm open to nights if it is on my desired unit. Why do I think that you should hire me for this position over other applicants? Well, I am dedicated, passionate about people, and pride myself on being a lifelong learner. I do not accept anything less than the best for myself and my skills, and I always work to improve, which I think is so important. I do not get complacent and think that what I'm doing is just getting by or good enough. I always try to improve. I take pride in my ability to ask questions confidently and seek out information that I don't know. I also believe that I am compassionate and truly care about helping people. This is the whole reason why I left my previous career to pursue nursing. I wish to help people when they're at their most vulnerable. And I believe that my communication skills and my nursing skills in conjunction with my drive and ambition would make me the best possible candidate for this role. What questions do I have? Could you tell me what piece of advice you would give to a new grad nurse to do well at her first job? And what you think would make a new grad nurse particularly successful at this position in her first few months? Thank you.